this helps you understand secondaries for any condition, not just the ones Jason and I talk about. Theoretically, you can connect secondary any condition to any condition, don't care what it is. There's one factor in between that, and it's evidence. So if you have the evidence to make the nexus, it's service connected. And, I've seen tinnitus, or I've seen sleep apnea secondary to tinnitus, which is difficult. Okay. It's absolutely not common, but think about it. You have tinnitus when you're sleeping, you're not really resting. And so your body's really like this inside. That's going to obstruct your airway. Boom, sleep apnea. I've seen that many, many times. There's these other secondaries, the most common, and I like how you brought up the medication. If you have hypertension, one of the medications is a blood thinner that makes you use the restroom a lot. It starts with a T. I forgot what the actual word is, but it makes you go use the restroom. My kids are on this hypertension medication. That's why I know about it. And they use the restroom all the time. And so now, well, as a veteran with hypertension, even at 0%, because medication controlled, right? We all know 0% hypertension is absolutely baloney, and I can't disagree with that. But if you're on that medication that makes you use the restroom a lot, there's an easy secondary for urinary frequency. That's one diagnosis. There are many, but it's rated 10, 20, and 40%. And who knows about that? Every time I see hypertension, I immediately say, hey, what medication are you on? Yeah. If it does fall within the making you use the restroom, immediately submit that secondary, which is it's extremely common to service connect. It's not common to see veterans who are service connected because no one's claiming it, right?
Right. Yeah. It's so funny you brought that up because I just answered a comment on that, the same thing. That I was like, look, this is common that this would happen due to that. So here's an interesting thing. And this is for anybody out there that knows or is a Vietnam veteran who was in an Agent Orange area, right? So for your presumptive conditions. Gentle reminder that not very long ago with the PACT Act, they made hypertension a presumptive condition. This is a condition that Vietnam veterans have been trying to file for and get denied over and over and over again prior to this being implemented as a presumptive condition. So now, if you have not, I'm going to throw out a couple things. This is almost like a public service announcement now. Yeah. If you have not filed for your hypertension, or a veteran who served in an area that had Agent Orange, you should absolutely have them, or you yourself should file for your hypertension. It's a presumptive, makes it super easy. And like Clay said, file for that urinary frequency issue and get that put in there as well. Those two should go hand in hand, probably more than likely, right? So on a side note, sadly, we're losing lots and lots of Vietnam era veterans now as age is sneaking up on all of us. If you are the surviving spouse of a Vietnam era veteran who has passed away, for example, due to a heart attack, they may have had hypertension, high blood pressure. If they were diagnosed for that, you can get them, get their death certificate amended to say that the cause of death was their heart attack, but a contributing cause of death would be that hypertension, high blood pressure. Then that is a presumptive condition. You would then file a claim for your DIC, dependency indemnity compensation, leveraging that aspect. I would highly suggest work with an accredited representative out there to help you file that DIC claim, and that will pay you out anywhere between $1,600 or so per month, all the way up into the $3,000, depending on a whole host of varying factors. But the bottom line is that this is a benefit out there for you, the surviving spouse. So please make sure that you look into that. Get with an accredited rep. That's my public service announcement. Yeah. Back to you, Clay.